The following interview takes place in the Hospital General Aurelio Valdivieso with Dr. Armando Quero Hernandez, head of the pediatric cancer area, where I conduct volunteer EFT sessions with the patients, their families, and the staff. Scenes from this interview are included in the Oaxaca Project video.
I am Dr. Armando Quero Hernandez. I'm a pediatric oncologist. I've been working here for 15 years in the Hospital General Dr. Aurelio Valdivieso in the state of Oaxaca, Mexico.
What have you noticed before and after the use of EFT in the cancer area?
As a result of EFT, I started to see changes. The family less tense, kids more dynamic, more comfortable. It is more relaxing for them, and that is transmitted to and results in less tension in the nursing and medical personnel. In addition, the environment becomes very positive. It is more motivating to come to this area because we know all that we can offer and all that the family and patient hope from this place. All of this has been improved because of EFT. Because of the results of this extremely fruitful experience, with EFT, when used to treat children with cancer, hopefully it can be applied and reproduced in other areas. EFT is something that can substantially help the quality of life of the child, the way in which the family perceives things, how the doctors confront problems, and how it helps the staff give attention to the child with cancer. EFT has a lot to offer the medical team to mitigate this grand mix of problems that is implied in a child with cancer.
How is it complementary?
There is an emotional part of having cancer that allopathic medicine doesn't handle either for lack of knowledge or because we haven't mastered this technique. The fact is, having cancer has a dramatic impact on the emotional part of the family and patient. If one doesn't manage these emotions, everything will be a failure. The fundamental role of EFT is addressing the emotional aspect so that the treatment functions better. Thus, EFT is complementary because the child rebels a lot and doesn't participate if you don't use this technique. In addition, the family has their doubts about whether the treatments are necessary. In this way, I believe it is helping in a very positive way to our treatments.
Would you talk about how, when the allopathic treatments are not functioning and a child is terminal, whether you find EFT still effective in helping the child? What is your opinion, or what have you noticed?
There are children that, because of the biological condition of their illness, that it would be difficult or not likely that chemotherapy would give them a chance to live or survive. I believe that EFT has a role in this important moment of a major crisis such as impending death, grieving, and agony. Sometimes for children, the agony is so distressing that they can't accept the path they are on. Here, I believe EFT has an important role to help lead them, so that they leave their body tranquilly, die while feeling happy, and so that the family can accept this transition because it is something that has to happen. If it occurs peacefully, without trauma, or a lot of pain, it is better for the one living as for those who stay behind. EFT has very important role in this moment of major crisis.
How do you feel that the use of EFT in the hospital can help reduce costs, as well as help the staff help themselves?
EFT results in a more tranquil emotional state and hematological recovery, which in itself has many implications at the clinical level. It reflects at the institutional level too. If there are fewer complications from infections or reduced infections, the consumption of reagents in the laboratory is reduced. If there are fewer complications, there can be fewer hospitalizations. When a child is hospitalized for a long time, there are added risks of complications, implying more costs, more nursing staff time, and utilization of a bed that could be occupied by another child. Then, without a doubt, there is an economical impact. It can have an impact in many ways beyond the economic aspect, as it can result in a substantial savings without affecting the final results. Good quality of life.
Do you have any examples of specific children where you have personally seen or felt that there was a strong change after the use of EFT?
I know of several children. For example, Lucero. She had a metabolic problem derived from medications, and even though she had a relapse, she resisted the continuation of her treatments. The mom was thinking of taking her home to die. After EFT treatment, her spirits recovered and she started to take her medications again. She became more cooperative. Fortunately, in this moment she was without tumor activity. The mother was very convinced that this other opportunity, which was just that, another opportunity that she gained because of EFT, that could allow her daughter to survive. Another child is Diego. Diego is an adolescent that at the point of finishing his treatment and going into observation, when unfortunately had a hematological relapse, a very aggressive relapse with his leukocytes reaching almost 100,000 leukocytes. He was disillusioned because he thought he was going to conclude his treatments and go into observation only when in his last consult we gave him the bad news that he had a problem and his leukemia came back. It was a powerful emotional impact. The first days of treatment, he was depressed with a lot of upsets, a metabolic problem, a lot of pain, and he didn't want to do anything. As soon as you initiated the application of EFT with him, his attitude began to improve. The metabolic condition was controlled. His immune system, that had been in decline, began to recover surprisingly fast, along with better control of a viral infection that he had. Personally, I've had the opportunity on 2 or 3 occasions to use EFT in the case of a migraine and tiredness and fatigue. I found it relaxing, liberating, stimulating and motivating. I'm completely convinced that we need to continue applying this technique here.